So continuing from the last video, so fecal transplants are becoming pretty popular and helping treat a lot of problems like inflammatory intestinal diseases. Okay, now the genitourinary tract. Some common organisms here for the urethra, although we would hope not to see much, if any, but at the end of the urethra, Staphylococcus, Staph aureus, diphtheroids, Bacteroides, Viridans streptococci, Mycobacterium, Fusobacterium, and Peptostreptococcus. In the vagina, Lactobacillus, Gardnerella vaginalis, Candida more common, but also possibly Peptostreptococcus, diphtheroids, Viridans streptococci, Bacteroides, and Clostridium. The section objectives for this next section should be able to describe ways that microbiota benefit the health of their host, explain the risks of having a microbiome, especially to immunocompromised hosts, discuss how host microbiota relationships are studied in the laboratory, and describe how the compositional balance of our microbiome can be compromised and the potential effects on the individual. So the benefits of the microbiome. Members of our microbiota are often beneficial in a mutualistic relationship. And here's how they help. They digest our food. They synthesize important compounds that we may not be able to, like certain vitamins. They interfere with colonization by pathogens, so they compete. For example, they compete for attachment sites. They compete for food sources. They synthesize antimicrobial compounds. Training and enhancing function of the immune system by producing immunomodulins that modify the secretions of cytokines. But it's not without its risks also. Microbiota may escape from their normal places or niche and cause infection and disease. There are opportunistic pathogens among the microbiota cause disease in immunocompromised hosts. This is compounded by acquired antibiotic resistance. And we can talk about the double-sided effects here, or impacts. Enterotoxins produced by some of the gram-negative pathogens damage the small intestine of the host and cause diarrhea. The enterotoxins may also protect against colorectal cancer, though, by activating membrane calcium channels in the intestinal epithelial cells. This increasing the calcium transport then turns on the antiproliferative pathway that slows cell division. Okay, the objectives for this next section, we want to be able to list and compare the various barriers that separate the microbiome from the host, explain the function of tight junctions in preventing infection, and discuss the role of the innate immunity in preventing infection by microbiota. So first of all, we have epithelial barriers, basically the skin. They're held together by tight junctions formed between the cells. So basically it's like molecular glue. It's a series of molecules that attach to the cytoskeleton in the cells. The tight junctions are regulated and they only open and close in response to certain signals. So with the tight junction barriers, we can talk about epithelial barriers. We have glycoprotein-covered epithelial cells that line the mucosa of the digestive, genitourinary, and the respiratory tracts. Then you have the blood-brain barrier. These are very tight junctions between the endothelial cells of the capillaries to the brain. These along the choroid plexus, and they occur between the epithelial cells that surround the capillaries, control the passage of substances from the blood into the cerebrospinal fluid that bathes the brain and the spinal cord. Very selectively permeable area. Then we have the maternal fetal placental barrier. Placenta keeps the fetus pathogen free by separating the maternal and the fetal circulation. Placenta still enables the transfer of oxygen, carbon dioxide, nutrients, and waste products between the mother and the fetus without the maternal and fetal blood ever mixing. So very few species of bacteria that find their way into the mother's circulation can pass through the placental membrane and the endothelial cells to infect the fetus. One of the few that can, though, is Listeria monocytogenes. Okay, let's look at this case history, the deadly hangover. Hiroshi, a 19-year-old college student, arrived at the emergency department complaining of a fever and lethargy that started the previous evening. He originally suspected that the symptoms were due to a hangover from a fraternity party held 2 days earlier. However, Hiroshi became alarmed when turning his head became painful and when tiny red blotches suddenly appeared on his skin. The physician recognized this as a petechial rash, red spots on the skin that do not blanch or turn white when pressed. Blood cultures were obtained, and Hiroshi underwent a lumbar puncture to obtain cerebrospinal fluid for culture. He was immediately admitted to the hospital and treated with intravenous antibiotics. The next day, the blood and CSF cultures grew a deadly gram-negative diplococcus, Neisseria meningitidis. Hiroshi had bacterial meningitis. So, Neisseria meningitidis is a bacterium that can reside in the nasopharynx of some individuals and carriers without causing disease. Carriers are immune but transmit the organism to a susceptible person. Transmission is more frequent between people housed in close quarters. The organism gains access to the bloodstream from the nasopharynx of the infected person and then can occasionally penetrate the impervious blood-brain barrier to cause deadly meningitis. Okay, this shows where the blood-brain barrier exists, shows the tight junctions involved. And things that can normally cross the blood-brain barrier include oxygen and carbon dioxide and alcohol. It's one reason why you can get drunk off of alcohol pretty easily. But some other things can get across but require a carrier, like glucose and certain metabolic byproducts, tryptophan and tyrosine and L-DOPA. Another case history, a tiny 1 kilogram female neonate was born 2 months premature. The baby had extreme difficulty breathing and had to be intubated, which is a breathing tube inserted. The mother at the time of admission had complained of mild diarrhea and abnormal abdominal pain unrelated to her pregnancy. The infectious disease doctor who was called in to consult on the case immediately recognized the likely problem and ordered blood cultures to be performed on the infant. The infant was also started on intravenous antibiotics. 2 days later, the lab reported finding a gram-positive bacillus, Listeria monocytogenes, in the infant's blood. The same organism was the cause of the mother's diarrhea. The mother had unwittingly ingested some unpasteurized cheese contaminated with this pathogen and developed listeriosis. The organism entered the mother's bloodstream and was transmitted across the placenta to the fetus prior to birth. This shows the maternal-fetal placental barrier. Okay, next let's talk about the role of microbiota in the immune system. And this is a relatively new field as well. So we want to describe the mechanisms by which the microbiota communicate with our cells and tissues, explain ways that our cells and tissues communicate with our microbiota, provide examples of benefits resulting from microbiota-host interactions, and argue the case for declaring our microbiome as organ systems essential to our survival as a species. So let's ask this question. Is the microbiome an organ system? An organ system can be defined very easily as a separate part of the body that performs one or more specific functions. The evidence that the microbiota is an organ system: there's 10 times more microbial cells than human cells, and 100 times more microbial genes than human genes. The microbiota is contained in separate defined areas of the body by tight junctions. Changes or harm to the microbiota may profoundly impact the host, and microbiota is inherited, at least initially, from the mother. Okay, for this next section, we want to be able to explain the role of probiotics in maintaining a beneficial microbiome. Describe the potential benefits of microbiome transplants, like fecal transplants in treating certain diseases, and discuss the prospects of phage therapy to control infectious diseases. We also want to explain the disappearing microbiota hypothesis. So the disappearing microbiota, the hygiene hypothesis says that changes in human behavior has led to the loss of diversity in the human microbiota. And this is done by the overuse of antimicrobials, dietary changes, cesarean birth, absence of breastfeeding, loss of diversity impacts, homeostasis, and greater enabling pathogenic bacteria. Here are some of the changes in human behavior that can alter the composition of microbiota. For example, clean water, reduced fecal transmission of bacteria. Cesarean deliveries reduce vaginal transmission. The use of preterm antibiotics reduce vaginal transmission. Reduced breastfeeding reduces cutaneous transmission in altered immunological environments. Smaller family size results in reduced early life transmission. Widespread antibiotic use accelerates the change of microbiome composition. Increased bathing, showering, use of antibacterial soaps accelerates the change of skin microbiome composition. And the use of mercury amalgam dental fillings accelerates the change of oral cavity microbiome composition.